Hi there. So as Jess said, my name's Jessica Milburn and I'm the home manager for Trinent Care Home, which is in Trinent in East Lothian. And I've just joined you today to spend a little bit of time telling you about what we experienced in the home last year when we had an outbreak of COVID-19. So on the 25th of March last year, we had our first positive case of COVID in one of our residents, which was just after lockdown had begun. And over the course of the following 6 weeks, we lost almost a third of our residents to the virus. And we also had a number of staff who tested positive for the virus, but thankfully none of those were seriously ill. During the outbreak, the staff in the home faced quite a number of challenges. Working in a care home, I think, is quite different for the staff than working in a hospital. Many of our residents have lived in the home for a number of years. We had some residents who'd been here 5 or 6 years, and strong relationships have been formed between them and the staff. So it was particularly upsetting when residents were passing away from COVID, because they'd become friends and almost like family to the staff. So it was particularly difficult when we were losing so many residents. We went through a particularly difficult period at one point when we lost 5 residents over a 36-hour period, and there was a definite shift in this point in the mood in the home, with a lot of tears in the home, a lot of sadness, and the staff really started to struggle at that point with what was going on. There were a lot of burnt out staff, and mental health issues became quite prominent in the home, with one of the staff members being diagnosed with post-traumatic stress disorder, and yet the staff just seemed to be so resilient and carried on caring for the residents, putting them first every day. One thing that the staff found particularly difficult was the focus that was placed on the NHS at this point. It was very early on in the pandemic, and while all the staff really appreciated the difficult time that the NHS staff were going through and the wonderful work that they were doing, it felt to the staff almost as if care homes had been forgotten about. So they were reading things in the press and on social media about the support being given to the NHS staff, about how wonderful the NHS staff were, about gifts and donations being given and fundraisers being undertaken. And it seemed to the staff as if care homes just weren't being acknowledged for the fabulous work that they were doing and for what they were going through during the pandemic. Another thing that was quite significant was when the doors closed to our care home at the beginning of the pandemic, it seemed as if all the support for the care home just dropped away. So we were used to having lots of different professionals in the home, and the phones constantly ringing, and relatives in supporting the home, and that all stopped, and it was quite an eerie feeling, and staff talked about being abandoned, and it felt very much as if we were fighting our battle all by ourselves, with nobody there to kind of support us and acknowledge what we were doing. As well as kind of going through the trauma of having a COVID outbreak in the home and losing so many residents that the staff were close to, they also had things to deal with, like the press. So we had reporters outside the home, reporters climbing fences in the car park to try and get photographs of what was going on in the home, reporters following staff to the bus stop after their shift and trying to talk to them. So as well as having to deal with all the emotions that they were going through, they had that on top of it as well, which wasn't particularly pleasant for the staff. I think as well it was particularly difficult in our home during the outbreak because it was so early on in the pandemic, and it was a very new virus. We were learning new things about this virus all the time, and so guidance was changing all the time, and it seemed almost every day there was something else coming in from Health Protection Scotland or from our company or from NHS about what we had to do now. And so for the staff it was quite difficult having constant changes to the guidance, but it was a necessity, but it was really quite difficult. And one thing that was difficult with the guidelines when we had our outbreak was the use of masks. So at the point of our outbreak, we were told just to wear masks when we were going into residents who were positive or suspected of being positive for COVID, whereas now we wear masks all the time. So the staff were probably unknowingly spreading this virus around the home if they had it and were asymptomatic. And so there were huge feelings of guilt among the staff that they had caused some of our residents to have this virus. So that was another difficult thing for them to deal with. So the staff were absolutely fantastic throughout the outbreak in the home, and they just got on with their jobs, caring for the residents despite what they were going through themselves. They were picking up extra shifts to make sure we were fully staffed. They were staying on at the end of their shifts and coming in on days off to sit with residents who were unwell. And I never once heard any staff complain about the workload or the pressures that they were under. So I think the big thing for me during this time was staff support. It was a huge focus, and I'll tell you a little bit about some of the things that we put in place in the home that the staff found really quite useful. So we had a notice board that was put up to give the staff information about sources of support. So we had information about NHS support lines that they could telephone, and also the company who owns the care home have a very good support line as well, which quite a number of the staff used and found very helpful. And we also had information about how to deal with stress and different emotions that the staff were going through. We also set up a notice board in our reception area where we put up positivity quotes each day that the staff could read when they came into work, and we would put up any cards or complimentary letters and emails that were sent to the home to kind of give the staff a bit of a boost. We set up a Remembering Me tree in the reception area. So whenever a member of staff passed away, the staff would write a message to the resident on a card and hang it on the tree, and any relatives who came in to visit residents who were coming to the end of their life, they were also writing messages and hanging them on the tree. And a lot of tears from staff when they were standing reading the messages that had been left on this tree. But it was really quite a special thing for the staff. And we've kept all of the tags to put in a huge picture frame that we're going to hang in the home so that we can remember all of the residents that we lost. We went through a period at the start of our outbreak when we had Alexas dotted around the home, and we would sync them so that they would play the same song. And at 3 o'clock every day, we would play a silly song, and the staff would be in the hallways in the home, and it would be things like Baby Shark and Agadoo, and the staff said it really helped them to know that it was actually okay to laugh and be silly for 5 minutes in the middle of the day, despite what was going on around them. So it kind of lifted their mood. I think when we had our period of losing the 5 residents in 36 hours and the mood changed, the staff didn't really feel it was appropriate to carry on with that anymore, but we've started it up again now, so the staff really enjoy that. One thing that I did for the staff was during our outbreak was write a card for every staff member. So we have 74 staff in the home, and I wrote a card for each of them with a personal message in it to thank them for everything that they were doing for our residents. And they really appreciated this, and with some of them saying that it was a lovely gesture and made them feel that their efforts mattered and were recognised. So I thought that was really important for them. After our outbreak, we started some fundraising, and we created a really nice area in the garden where staff and relatives and residents could go to sit quietly and reflect and remember. And we bought a remembrance bench, fencing, planters, and lots of plants. And we had a bit of a ground force day when a lot of the staff came in on the day off and spent the day creating this lovely space. And we actually used the space this week on the day of reflection we gathered in the area and remembered all the residents that we'd lost last year. We also had quite a lot of staff meetings, regular staff meetings, where we would just reflect on what we had all been through, where staff could talk in a safe space about the emotions that they'd gone through and the difficult time that we'd all had supporting our residents through the outbreak, and staff found that really useful. I always felt that what we were doing was never enough. I don't know what more we could have done, and I think today will be really useful to hopefully to find out other things that we could do should we be in a similar situation, or things that we can introduce into the home now, because even though it's been a year, it's a relatively short space of time, I think, after what our staff have been through. So that's just a little bit about what we went through in Trinent Care Home. Very, very difficult time emotionally for the staff. Very traumatic, losing so many residents in such difficult circumstances. And I just hope that I can learn more today to support our staff.